My name is Jay Belani. I'm one of the urology physicians in San Rafael. I'm going to be talking about the radical prostatectomy, or the surgery to remove the prostate gland. So what we're going to talk about when we talk about radical prostatectomy is, what do we do? What are the different methods to take out the prostate gland? What to expect after surgery? And what are our outcomes in regards to what happens with the surgery? When we talk about radical prostatectomy, the first thing we want to focus on is what's the technique. That way everyone has an idea of what we're doing during the surgery. The first thing is we're trying to remove the entire prostate gland and the seminal vesicles. I'll show you a picture in just a second. This is different than surgery that's done for an enlarged prostate. Someone can have a prostatectomy if they're having trouble urinating, and that can be done for an enlarged prostate. Another way to think about it, it's kind of like a roto-rooter of the prostate, or another abbreviation for that is a TURP. With that surgery, what the urologist is doing for the most common type of procedures is they're putting a scope in through the urethra and cleaning out the inside of the prostate gland. They're not removing the entire prostate gland. A radical prostatectomy is different. We're talking about removing the entire prostate gland and the seminal vesicles, which sit behind the prostate gland. So the way we do this surgery is we separate the prostate from the bladder, rectum, and the urethra. We then remove the prostate out, and we sew the bladder to the urethra, and we put in a catheter. That's a plastic tube that drains the urine from the bladder to let that area where we sewed things to heal. Our goal is to attempt to spare the nerves going to the penis and cure the cancer. We may also remove pelvic lymph nodes. Those are nodes that are in the pelvis of the body where prostate cancer may spread to. Whether or not we remove the pelvic lymph nodes is dependent on the stage of the prostate cancer, your Gleason score, and your PSA. So here's a picture of what's going on down there. You have the bladder sitting up here. The seminal vesicles are these purple things sitting behind the prostate gland. You then have the urethra with the sphincter here and your nerves here. The sphincter is what helps you control the urination so you're not leaking urine. The nerves here are what go to the penis to help for your erections,